Many of the doctors in ER do this deadly mistake. And you also think a snake bite is just a local wound? It can silently destroy clotting mechanisms and paralyze respiratory muscles within hours. Hi, this is Dr. Samrat. As usual, I am back with another emergency case scenario which we see regularly in emergency department. In this video, we will cover hematological manifestations, neurological manifestations, drugs to avoid, and exact indications for intubation in snakebite management. Yes, snakebite can silently destroy clotting mechanisms. The hematological manifestations are more commonly seen in viper invasion. Patients may present with bleeding from gums or bite site, hematemesis, melena, hematuria, or an incoagulable blood picture. The initial assessment for snakebite always start with airway, breathing, and circulation. Secure two wide bore IV lines and send blood investigations. The primary blood investigation 20-minute whole blood clotting test and coagulation profile PT, APTT, INR and platelet count and hemoglobin, renal and liver function tests. The antivenom therapy consists of ASV. The most important treatment is anti-snake venom or ASV. ASV is indicated if there is a active bleeding or if the 20-minute whole blood clotting test is positive. The initial dose is 10 vials of polyvalent ASV intravenously. Do not wait for lab reports if whole blood clotting test is positive. For reassessment, repeat the whole blood clotting test after 6 hours. If the blood is still incoagulable, give another 10 vials of ASV. The blood product should be used only after anti-snake venom. Fresh frozen plasma is given after venom neutralization only. Platelets are given only if platelet count is below 50,000 with active bleeding. Packed red cells are given if there is significant anemia or shock. What are the drugs to be avoided? Do not give tranexamic acid routinely. No NSAIDs. No intramuscular injections. Remember, ASV corrects the cause. Blood corrects the consequence. Snakebite can silently paralyze respiratory muscles within hours. This is a neurotoxic inflammation commonly presents with early doses. Other features include ophthalmoplegia, slurred speech, difficulty swallowing, neck weakness, progressive respiratory muscle paralysis. Immediate actions like all patients with neurotoxic signs must be shifted to ICU. Monitor continuously for oxygen saturation, respiratory rate, and single breath count. Keep the patient nil by mouth as the chances of aspiration increases. The antivenom therapy consists of ASV, which is very essential in neurotoxicity. ASV should be given immediately. The initial dose is 10 vials IV. If neurological signs worsen after 1 to 2 hours, repeat another 10 vials. Remember, ASV stops progression but does not reverse paralysis immediately. So, early ASV should be encouraged. The drugs usually to be avoided in snakebite. The certain drugs can worsen neuromuscular paralysis and must be avoided completely. Those are the aminoglycosides like gentamicin and amikacin, fluoroquinolones, macrolide antibiotics, magnesium sulfate, and benzodiazepines unless the patient is intubated, and muscle relaxants without ventilatory support. This should be avoided. What is the common question? When to intubate? The most critical decision. Never wait for respiratory arrest. Intubation is required if the oxygen saturation is below 90% despite oxygen. If respiratory is more than 30 or less than 10 per minute, it is also an indication for intubation. If patient using accessory muscles, definitely we have to intubate. If there is any paradoxical breathing and if the patient is unable to perform single breath count of 20 number and if the patient cannot lift the head for 5 seconds, if there is any bulbar weakness like drooling or dysphagia, these are all the intubation required signs. The basic bedside red flags like rapidly worsening ptosis, nasal speech, or inability to count till 20 in one breath are warning signs. Early elective intubation saves lives in these scenarios. Most patients recover completely within 24 to 72 hours of ventilatory support. Remember these key points. Bleeding means ASV first, blood later. Ptosis today means ventilation tomorrow. ASV neutralizes venom. Ventilator saves life. Early recognition and timely intervention make snakebite a completely reversible emergency. If you found this video useful, like, share and subscribe. More emergency medicine and critical care content coming soon. Thank you.